Okay, guys, so today we're going to talk about how virtual reality can benefit treatment resistant schizophrenic patients. I know all of you guys have definitely at some point taken care of schizophrenia patients. That's what you guys do. I think that there can be a lot done about the treatment for schizophrenia patients, and there is a lot of limitations. That's why it's so important whenever new therapies come out that we pay attention to them. And today I'm going to talk to you guys about how virtual reality can benefit these schizophrenic patients. And we're going to talk about how or what situations we would use this um, setting. Okay, so before we get started, I kind of just wanted to talk a little bit about me since you guys don't really know me. So I come to you guys today. I'm a graduate of USC Upstate. That's where I got my BSN. I've been a nurse for about 4 years now. I've worked kind of everywhere. Oddly enough, psych is one of the main places. I've never been a bedside psych nurse, but I've always had a very strong passion and interest in psych. So I worked at Spartanburg Medical Center. I did some vascular surgery, step down there. Um, I then went to work in like a nephrology unit after that, working with a lot of dialysis patients who do have a lot of underlying psych problems. And then I went to work for Shriners Hospital for Children, which was very interesting to see the psychiatrics behind in a family setting. But it was a orthopedic unit, so it wasn't a focus on psychiatric health. And then Greenville Memorial Hospital, I did their resource pool. I never had the opportunity to go to a psych unit, but I always wanted to. But I think all of us can agree if you've worked bedside along with if you've worked not bedside, everyone works bedside, but worked in psych, and then those of you who haven't, um, we see psych even when we're not working in psych. Everybody has psych problems, whether it be big or small. And a lot of these patients that come through, especially if they have chronic hospitalizations, will have some underlying psych problems. So most of us have had experience with it, even though if we haven't worked in it before. I'm going to have my master's degree in May, so hopefully once I get that, I can provide some more research into schizophrenia. It's always been a very strong passion and interest of mine is schizophrenia. So today I'm just going to talk to you guys about some research that I've done. Okay, so to be true to the presentation, like the assignment that we're doing, this is when I would ask because this is supposed to be in a lunch and learn setting. And whether it's in an inpatient or outpatient psych facility, it's supposed to be in like a classroom with like 30 minutes to review afterwards. And this is the part where I would ask them to tell me about their experiences, if they have always worked in psych, if they've had other experience, just learn a little bit about them. Um, and I would also ask them if they know what virtual reality is, because some people might not know what virtual reality even is, or be able to define it. And if they do know what it is, I would like for them to share their experience and maybe kind of foster some ideas on why they think that this would be a good strategy to help with schizophrenic patients, to see if maybe they can come to a conclusion before I explain it to them. That would be kind of cool. So I think it's really important. Obviously, before we go into how to treat schizophrenia, that we just set a general definition for schizophrenia. I'm sure most of you guys, I mean, not most, all of you have seen and experienced schizophrenia, but just to outline exactly what it is, because I know there's many different types. So we're going to define schizophrenia as a mental health disorder that is characterized by auditory and or physical hallucinations that create a sense of detachment from reality for patients that are affected. And this sometimes will result in behavior abnormalities involving self-harm and or violence towards others. The severity of the hallucinations can vary. I'm sure you guys know this. There are some patients who might not have a lot of hallucinations, but they do have thoughts and same thought processes as schizophrenic patients. So the schizophrenic patients are not always going to present the same, and none of them will present the same. They're all very different in their nature and how they present. I also wanted to talk about some of the current treatments for schizophrenia. One of the first things that they do use to treat schizophrenia is brain stimulation therapy. It's kind of where we're purposefully sending electricity through the brain. They put electrodes on the head. You guys have all seen this, and they send electricity through in order to try and solve some of these psychiatric issues. This is not the only psychiatric disease that they will use this for. Um, Some of the side effects are a little rough when we talk about brain stimulation therapy. They include like headaches, muscle aches. They can have some memory loss and some confusion. So if this can be avoided, obviously this is not the best choice out of the therapies, but if it's going to help them, then it's a benefit outweighs risk sort of situation. One other thing that we can do to treat schizophrenia is use medication. Usually this is not the sole source of therapy. Usually use this in combination with other therapies. And I know there's a lot of talk about mental health medications and their side effects because they can be a little scary to some people. Some of these, a big one is tardive dyskinesia. A lot of mental health medications can potentially cause tardive dyskinesia. They can cause metabolic changes. They can oversedate. They can cause a lot of sexual changes. So depending on the age group, these are a less popular option. I think a lot of this kind of scares people, which is, rightfully so. I don't think we need to validate people's fears and understand them. The other thing with these medications is it's going to most of the time is going to take several tries to find the right medication. And I think this warning kind of scares people a lot of the time. Sometimes that first medication you go on might make symptoms worse, or it might not help you much at all, and you got to move to something else or use a different combination. So if we can stay away from mental health medications anytime it's possible is better. One of the other things that we do currently for schizophrenia is psychotherapy. This would include like a one-on-one session with a licensed therapist. We do this to kind of redirect negative thinking habits. If we can notice a way that someone's thinking that could maybe be potentially putting them into a schizophrenic episode, then we can try and redirect that way of thought before they get into an episode. But psychotherapy is going to be very difficult in severe cases. They're probably not going to be able to participate in psychotherapy. And unfortunately, virtual reality is a form of psychotherapy. So that is a consideration we need to have, whether or not they're even a candidate for this, because some severe cases won't respond well to this kind of therapy. So the virtual reality treatment is actually, like I just said, it's considered a part of psychotherapy. So we need to consider that before we start using it, whether or not the patient can tolerate it and if it would make their symptoms worse. One thing that's important to note here is 40 to 70% of schizophrenic patients will be resistant to first-line medication. This medication most of the time is clozapine to help with schizophrenia. So it's important to know that even though we try first-line medications, a lot of the time they're not going to work. So this is one of those times where maybe we could try a virtual therapy session or a virtual reality session, maybe even before we try medications. This virtual reality therapy is also known as avatar therapy. It was developed by Julian Leff in 2008 and has been built on since then. And virtual reality is getting much more accessible and much more easy to use lately. So I think we're just going to keep going in that direction. So this could potentially be a very large area of research later down the line. And whenever we're doing virtual reality, the entity, so the process is the scientists create, or the therapists create an avatar based, or an entity based on the schizophrenic patient's biggest hallucination or most disturbing hallucination to them. And the virtual reality allows them to speak with it and understand that it's not out to get them and that it's not what they think it is. It's not dangerous, and that it doesn't need to be paid attention to. And when we talk about this entity, they call it the avatar, which is where the avatar therapy term came from. I think it really helps because schizophrenic patients, sometimes when they're in a schizophrenic episode, are very manic and don't have the ability to understand that it's not real. So if we go into a controlled situation and we can show them that it's not a dangerous situation, then what they're seeing is not going to hurt them, I think it would help, and it has proven to help their symptoms. So avatar therapy has been shown to greatly reduce the effect of hallucinations in patients' day-to-day life, and it also has been shown to impact quality of life altogether with these treatment-resistant schizophrenic patients. The patients who have undergone this have reported less hallucinations, which is, that's the main goal of schizophrenic treatment. Another interesting part of this therapy is it's really allowed us to understand the process of schizophrenia A lot of it is still unknown, the process and obviously how to solve it, because it's a little unknown what's going on in the brain that causes this. And we keep figuring out more and more about it. But any way we can help treat it while we try and figure out more is always useful. This avatar therapy, whenever they were doing it in a controlled study, there were 5 major themes that were developed using it. Emotional response to hallucinations, beliefs about voices in schizophrenia, self-perception, coping mechanisms, and aspirations. These were all benefited from this therapy. These were the 5 main themes that were benefited from this treatment. So this slide's kind of talking about the difference in between current treatment and virtual therapy, virtual reality therapy. Virtual reality is a lot less invasive than a lot of current therapies. I know we talked about brain stimulation therapy and medications. Those two specifically are very invasive and they can cause problems. And I think this is a very good option when those aren't working, obviously, because we're talking about treatment-resistant schizophrenic patients. This also allows patients to face hallucinations head-on in a controlled environment, to kind of manipulate their way of thinking, to help them see that their regular way of thinking is unhealthy and that it's not the correct way to view the hallucinations. Sometimes you hear about schizophrenic patients having hallucinations, but they're not always negative. So maybe we can turn negative into a positive, at least if we can't get rid of the hallucinations altogether. And again, this is really effective when traditional treatments are not effective. Sometimes the medications and brain stimulation therapy can control this better than this. This is just to aid those patients that do not respond to medication or brain stimulation therapy or any of the other traditional treatments. So I think in all, virtual reality is worth diving deeper into to learn more about its process and how it can help schizophrenic patients and even patients that have other mental health disorders. And I think this last point is one of the more important things that I can tell you guys is just because a patient is not responding to traditional treatment does not mean that the patient is hopeless. I think a lot of us can slip into an idea that if traditional treatments are not working, we just give up, and that is not at all what we do. I know that there's been a lot of studies about how to help these patients because a lot of patients, as we talked about earlier, are treatment resistant with schizophrenia. So it's really important that we encourage and facilitate a lot of these studies as much as we can. And these are all the references I used for just the definitions of schizophrenia, and I pulled some information from different studies about how this avatar therapy can help positively impact schizophrenic patients who are treatment resistant. So the last part of my presentation would include a test. Usually this would only be a 30-minute session, so hopefully they're done eating around 20 minutes, so then we can pass out the test, and then it would be a multiple choice just for time's sake, and help them go through the answers, and we would allow them to choose what they think is correct and understand why they made those decisions if they're not the right answer, and on their way out they can hand them back as their ticket out the door.